In the remote corners of Kenya, a silent killer stalks the most vulnerable. Kala Azar, also known as visceral leishmaniasis, is claiming lives that could be saved.
Between June 2024 and May 2025, we registered a total of 606 VL cases. This is Kala Azar, including 276 reported within the first 5 months of 2025. In terms of mortality, 26 deaths were recorded in 2024, with an additional 18 deaths already reported by May 2025.
Each number represents an individual bearing the pain of a disease that has ravaged this part of the country for many years. Meet Peter. He has brought his 3-year-old for treatment.
Alikuwa na pipa, has been coping, vomiting also. I was not able to eating. Those are the symptoms of the
Kala Azar treatment is free, but most patients arrive in critical condition.
We've struggled on issue blood. So because of the upsurge in Kala Azar, most of these patients require transfusion. It has increased our need for transfusion.
The disease is caused by infected sandflies. It affects the immune system and is almost always fatal if not treated on time. Kala Azar affects some of the poorest communities and is associated with malnutrition, population displacement, poor housing, and a weak immune system.
Ongoing interventions include strengthening knowledge and capacity among health workers, community health promoters, and the community at large to promote behavior change and timely referral. Because the reason why we were losing many people is delayed referral of cases that were suspected of Kala Azar.
Kala Azar is a neglected tropical disease. A patient has to be hospitalized for 17 days during treatment.
Can imagine telling people who are already, they are dependent on pastoralism for their livelihood. You're telling them essentially to stop doing everything that they're doing, to come to the hospital, and you're going to take them for 17 days. And in an outbreak situation, if every single person has to stay in the hospital for a minimum of 17 days, your hospital is going to be full.
The challenge is, first of all, the disease itself, the pathogen. There is no easy way of clearing the parasite in our body, which requires prolonged hospitalization. But in the future, we don't know whether that will be solved.
As Turkana County put up a fight against the disease, so was Wajir County. Both counties had to deal with a huge number of patients at their referral facilities. The numbers have now gone down in both counties. For Wajir, numbers reached their peak at the beginning of this year.
The resources in Wajir were really, really overwhelmed because they were seeing large numbers of patients, all of them quite severely. They are far from their homes. They're very distressed. They know there's this disease that's coming around and they don't know what to do. The only place they've heard that there's help is Wajir County Referral Hospital. And so once they get there, then it's quite overwhelmed. Then they wonder, okay, what do we do?
What do we do now? This question has been asked countless times before.
Even access is a big problem. There are people who are not getting the drug, just being well affected because there is no enough funding. So the most important thing is providing even the available treatment.
That's probably also why we don't have good data, because we don't have the tools to be able to demonstrate that this is a problem. So if you're not testing enough, if you're not treating enough, if you don't have enough diagnostics, then you can't really even have enough data to say, this is a problem.
The investment starts from the government, owning different activities, including research and development activities, donors, and pharma companies to discover new drugs.
Look, it's brutal. but simple. Big Pharma follows the money. No patient numbers, no business case, no funding, no drugs. In the eyes of business, Kala Azar doesn't have enough victims to make it profitable. So these people just rely on the benevolence of well-wishers.
One of the treatment options, which is considered as the second line treatment called Amdizol, is a donation by the pharma company to WHO. WHO does the donation and distribution to the countries. But for other diseases, there are only single manufacturers, and the market is not attractive to bring new manufacturers.
How does that make you feel?
It is very challenging, but I think through time things can change. So currently there is an interest, for example, from different partners to be engaged in elimination of visceral leishmaniasis in Eastern African countries.
We need more funding, and not just funding as in we need more money, but we need more resources channeled towards research and development of new drugs, new diagnostics, better quality drugs that have less side effects. We need that kind of injection. We need more knowledge on these illnesses.
Since Kala Azar targets the most vulnerable communities, society faces an urgent challenge. How do we ensure consistent access to treatment and ultimately eliminate this preventable killer? For Defrontera Media Group, I am Anne Mawathe.